From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Lawrence Brent, a rheumatologist with Einstein Healthcare Network, and this is the Rheumatology Show. Our topic is gout, so let's get right to the questions that stem from our viewers, Dr. Brent. What exactly is gout?
Gout is a form of arthritis that's related to elevations of a certain chemical in your blood called uric acid. And over many years, if this chemical is elevated, eventually this forms little crystals that deposits in and around your joints. And over time, you can get these flares where the crystals get inside your joint and causes very, very intense inflammation that the patients usually remember quite well. Often it occurs first in your toes, sometimes waking you up in the middle of the night.
So how is gout typically diagnosed in patients?
Well, the first thing is, taking a history, talking to the patient, asking them questions. So often we're seeing a patient that's sent to us by another doctor and they think maybe the patient has gout. The history will be, maybe for the past year or 2 or 3, I've had these episodes where my toe gets very sore and red for a week or 2 weeks, and then I take some medicine and it gets better. And at that point, that is a history that's very, very consistent with gout. Sometimes we'll see a patient in the hospital or in the emergency room, or occasionally even in our office, where they'll come in for the first time. My foot's all swollen, what's going on? And then you go ahead and take this history that it came on very suddenly without any injury. And, all of a sudden it looks like, very red and swollen. And certainly that's consistent with gout.
Excellent. So Dr. Brent, how is gout typically treated?
Well, when you treat gout, the first thing you want to do is make sure you have a diagnosis that's accurate, because this is a chronic disease. Once you're diagnosed with it, like diabetes or high blood pressure, you're stuck with it.
Okay.
So if a patient comes in my office, they have a swollen foot, one of the things I want to do is actually get fluid out of that joint, look under the microscope at that fluid. We have a special microscope in our office, and we can see the crystals and make a diagnosis of gout right at that time. Once you do that, you know you have the right diagnosis. And once that's done, then you need to do treatments to do 2 things, or 3 things, I should say. One is to get rid of that acute attack, which we have medicine for that. The other thing is you don't want them to keep coming back with an attack, right. So we have medicine for that. And the last thing is you really have to lower that uric acid. Mm-hmm. Sometimes you can lose some weight, or maybe change your diet, or adjust other medications, particularly blood pressure medications, but often you really need a medication that will specifically lower that uric acid. And over time, that will keep these attacks from returning.
So what are some signs that a person may exhibit that they may need to get checked out for gout?
Again, the most common thing that we see is these episodes that occur maybe every few months, where for no particular reason they'll just get a swollen ankle or swollen toe, although it can occur in almost any joint.
Sure.
Sometimes we do see it after a patient started a new medication like a diuretic, or they went out and drank a little bit, particularly beer.
Okay.
They had a lot of certain foods like organ meats like kidney or liver or shrimp, a lot of the seafoods. So sometimes these are things that can trigger it. Or sometimes we see these patients in a hospital, like after a heart attack or a stroke. That's also something that could trigger an attack. So again, those are the kinds of things we hear from the stories of our patients.
So does a person's diet affect their risk for gout?
The diet is important, but there's a limit to how much you can treat someone with just diet. So again, there's certain foods that are high in purines, and that's a chemical that eventually gets turned into uric acid.
Okay.
And unfortunately, humans and other primates, they can't really get rid of uric acid so easily, so it accumulates. So again, organ meats, which in the United States, I haven't found a lot of people that are really heavy into organ meats, which would be, again, pancreas, liver,
right.
kidney. But the seafood is a big one. And again, high consumption of beer. And also what's become more prevalent recently is the high fructose corn syrup, which instead of using sugar, a lot of these soft drinks are using that because it's cheaper.
Right.
I don't think it tastes as good, but that's my personal feeling. But what happens is that drives increased production of uric acid. So people that are drinking like these sodas and other soft drinks, a lot by the gallons, they're more prone to gout also.
So in this day and age, is gout typical? Years ago, it was very typical. You heard, I have gout. But in this day and age, is gout typical?
Actually, gout is a disease that's associated with aging.
Okay.
So, Americans are living longer, so it's more common than it used to be. The other thing is we're seeing more patients who are living with chronic kidney problems and high blood pressure and these other medical issues that are associated with an elevated uric acid. So it is a disease that is actually getting more and more common as time goes on.
And what should the general public know about gout?
Well, what I find is some patients, they say they have a history of gout, and then they'll tell me, well, there's really nothing you can do about it. And the problem is you get these acute attacks, and they go away even without treatment over a period of time. So the patients think, well, it's not so bad. My joint looks exactly the same as it did before. But over time, this uric acid will get collected more and more in the joints, and it will eventually cause permanent damage. And the fact of the matter is there is treatment that is available, and we don't do as good a job as physicians in general recognizing and treating gout as we could. I think we could do a much better job if the patients show up and they take the medication, they get that uric acid down, they're going to do much better over time.
Dr. Brent, thank you so much for sharing this great information.
Thank you. It was my pleasure.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Rheumatology Show. We will see you next time.